In this video, I'm showing you a way of visualizing the difference between HMOs and PPOs in health insurance. Now, the actual terms stand for Health Maintenance Organization and Preferred Provider Organization, but to be perfectly honest, this name is really non-descriptive and really doesn't say very much about the structure. This name is a little bit better, but either way, these have just become entrenched in the language of healthcare economics and healthcare policy, and so we're going over them. So let's start with an HMO. An HMO is where the insurance company and the hospitals and the doctors are all under one organization. They're all under one CEO. And sometimes the doctors groups will sort of have their own semi-independent organization that's linked heavily with the HMO, but generally it operates as one single big organization. A PPO is a little bit different. So let's visualize a PPO. With a PPO, the insurance company does not run the hospitals or does not work closely with a doctor's group. It's almost part of the organization. With a PPO, basically the insurance companies negotiate with doctors and hospitals for in-network status. So the insurer will sit down at a negotiation table with the doctors and come up with a price that obviously the doctors want a higher price, the insurers want a lower price. They'll come up with a price, and if the doctor is willing to work for that price, the doctor will be listed as in-network, which is going to be cheaper for patients. So patients are more likely to go to an in-network doctor, so it increases the demand that these doctors face for their services. And if a doctor says no to that price that the insurer is putting on the negotiation table and maybe holding to, then the doctor has to be out of network, in which case the people who are insured under the PPO will have to pay a higher price out of the patient's pocket to go to that out-of-network doctor. And that's basically the difference between an HMO and a PPO.